Keep your hands clean by washing them.
In iTunesLiberia.com.
We are project. Liberia. Mama Liberia. Must all rise. Stand together to fight Corona.
Good morning, everyone. Good morning to our viewers. Good morning to our distinguished listeners. Thank you very much for being with us this morning, and welcome back to another edition of the Memorial Men Health Talk platform. This platform is a 1-hour program that discusses a wide range of health-related issues. It brings you face-to-face with health professionals and provide you with causes, signs, and symptoms, complications, and preventions of diseases and illnesses affecting us in our respective communities. On today's edition of Health Talk, we will be focusing on World Hepatitis Day. This year that falls on July 28th, but really it is an area of concern throughout the year. In fact, World Hepatitis Day is celebrated annually every year. And this is the only day that World Health Organization has sponsored. World Health Organization has sponsored only 8 Health Awareness Day, and this is one of them because worldwide we see 1.5 million premature deaths due to hepatitis. This is a real public health issue here in Liberia and around the world. We are very privileged to have with us today distinguished panelists to discuss this important topic. We have with us in studio Mr. Manuel Thomas Ja, a 2016 graduate of the University of Liberia with BSc in biochemistry. He is a final year student at the A.M. Dougherty College of Nursing. Next to him is also Mr. Vama Esano, a youth leader, an advocate, and a final year medical student at the A.M. Dougherty College of Nursing. In 2016, he obtained his first degree, BSc, from the University of Liberia in biology. He is an educator with over 8 years of experience. He holds several certificates in leadership and youth development from several institutions online and other reputable organizations or institutions in Liberia. He also serves as the senior councilman of the Liberian Medical Student Association and chairman of the Lofa Medical Student and Health Practitioners Association. To be part of the discussions, or if you want to call and share your experience with us, the numbers to call is 0770 107 107 0886 107 107. If you are outside Liberia and you want to be part of this important discussion, our WhatsApp number is 231 880 571 223. So sit back, relax, and learn from this educated health talk coming to you just after a short break. I am Mama Eluman. This is Health Talk.
In iTunesLiberia.com.
We are project. Liberia. Mama Liberia. Must all rise. Stand together to fight Corona.
Good morning, and welcome back to today's edition of Health Talk. Again, hepatitis is a public health problem in the country, and taking actions against disease begin with awareness. So, join us this morning as we take you through this fascinating discussions. You can also be part of the show by calling our hotline number 0770-107-107, 0886-107-107. If you're overseas or also Liberia, if you want to be part of these discussions, our WhatsApp numbers to call is 231-8805-71223. That's our WhatsApp number. So this morning we are discussing hepatitis. And let us start with you,
Faba is Sano.
Mr. Sano, right? Or incoming Dr. Sano.
Sure.
So I refer to you as Mr. I refer to you as Dr. So please pardon me for today.
No problem.
Okay. Today we are discussing hepatitis. Let us start with the basic. Now we're talking about hepatitis medically for the public to understand what is hepatitis.
So thank you very much for the platform, and thank you to our listening audience. So hepatitis, for short, is actually the situation that has to do with the inflammation of the liver, or a condition known as the inflammation of the liver. So when the liver gets inflamed or gets swelling up, so referred to as hepatitis in medical terms.
Okay, inflammation of the liver.
The liver is an organ of the body, very important, vital organ of the body. So once you get inflamed or swelling up, in medical term.
Anytime we hear the word hyper means liver and tatic means inflammation, right?
Sure.
So definitely hepatitis is the inflammation of the liver. So okay, let's move to you. What causes this hepatitis?
Thank you very much. Thank you for this important platform. I'm Manuel Thomas Zai again, one of the panelists. As the first speaker said earlier on, hepatitis is just the inflammation of the liver. It may either be an acute process or it may be a chronic process. And the causes of hepatitis range from an infectious cause to a non-infectious cause. When we say an infectious cause, we mean viruses cause hepatitis. There are 5 basic strains of viruses that causes hepatitis.
Sure.
The hepatitis A, the hepatitis B, the C, the D, and the E. These are the 5 basic strains, but there are other viruses also that causes hepatitis, and we also have some non-infectious causes of hepatitis. So some non-infectious viral causes of hepatitis, like for example, in syphilis, people who have syphilis, they are prone or the risk of developing hepatitis. We have some non-infectious causes like alcohol. People who drink excessively, they also stand a risk of hepatitis. So the causes of hepatitis range from an infectious cause to a non-infectious cause. As I listed earlier, the viral causes, non-viral causes, and those non-infectious causes.
Okay. Thank you so much. So let's move right to Dr.
Baba.
Pardon me. So we're discussing hepatitis, and in your opening statement when you were describing hepatitis, we were talking about inflammations of the liver, right? We seem to have developed a system based on assigning letters, like him we're talking, right, to different types of hepatitis, right? Like A, B, C, D, and E. So what are the major types that will be of concern in terms of infections?
So the most contagious one of the 5 strains of the viruses that cause hepatitis are the hepatitis B and the hepatitis C. These are the more contagious ones. So once you have them, and the progress of the disease and then the complication of the disease is a serious concern. So like I said, the infectious causes are the 5 strains of viruses. There are even other bacteria that cause hepatitis. The pathogenic bacteria, those bacteria are bacteria like a create pus. So for example, the E. coli, the Strep aureus, these are bacteria that cause, they are also cause hepatitis. And then the non-infectious cause that he talk about, it can be alcohol and it also be drugs. There are some drugs that can also lead to or like expose you to getting hepatitis. And overuse and overdose of these drugs can lead to hepatitis. For each in our setting, paracetamol is one. Another will be the non-steroidal anti-inflammatory drugs, like the diclofenac and now the naproxen, ibuprofen. There are other drugs, even anti-TB and the TB medication. Like.
Okay, let me hold you there. Before we go to drugs aspect, I just wanted to know of the 5 different types of hepatitis, which is from A to E. Am I right?
Yes.
So I wanted to know what are the contagious ones, especially looking at our setting in Africa, especially Liberia.
Okay, like I said.
So I think we'll focus on A, B, and C.
Okay.
Definitely, right?
Okay.
I think we got that in Africa.
Yeah, these are the 5 types of viruses that cause hepatitis. So for the B and the C are the contagious ones, like I said.
Okay.
Yeah. So for D, the hepatitis D is very rare, and most often it causes people who already have hepatitis A.
Okay.
The information is that hepatitis D can only replicate in the presence of hepatitis B.
Okay.
So if you have hepatitis B, it's possible you have co-infection of the 2 viruses, meaning you get both B and D together, or you have superimposed infection, meaning you already got hepatitis B virus, and then in subsequent time you came across hepatitis D. And the prognosis is very bad because the replication and now the progress of the disease is very rapid, and the complications lead to serious injury to the liver and now death.
Okay, thank you so much. Again, Mr. Thomas Child, let's move to you. We are talking about hepatitis, and he said it's the inflammations of the liver. And we know that the liver is one of, or also the biggest organ within the human system, right? The human body, with the exception of the skin. So now, looking at the liver, how do it function? Why do we say inflammation of the liver? Well, we know that the liver is the biggest organ within the human body. So I just want you to list some functions of the liver.
Okay, so now as you may be aware, the liver is the biggest function in the human body next to the skin. The function of the liver range from metabolism, the production of clotting factor.
Sure.
You know, when we have bleeding processes, how clotting factors are produced. The liver is also responsible for it. The liver is also responsible, like for example, in infants for the production of blood and other substances. For example, those proteins that are responsible for our blood, for example, like albumin. The liver also produces albumin for oncotic pressure. So the liver has many functions. So when there is inflammation of the liver, all of these functions are impaired, and when these functions are impaired, the liver tend to degenerate, and once it degenerates, the adverse effect comes to the entire body.
Okay, thank you so much. Thank you so much. Indeed, the liver play a major role in our body, as we are aware, or as you may be aware, or if you don't know today, you gotta get that straight, that the liver is one of the biggest organs within the human body, with the exception of the skin. So the liver plays so many functions. In fact, the liver plays a very pivotal role in care of the stages of the body, right? Yeah. Because it detoxifies, it helps maintain glucose level, bilirubin, all this stuff, clotting factors, all this stuff. So the liver play a very major role within this. So just get that if the liver is inflamed or inflammation of the liver, what's going to happen? The body will not function in the way it will function, right? Sure. So that's the time. Can you just tell a little bit about some signs and symptoms of the disease? Because I don't want to rush. I don't want to go further. Can you just
Yes, I will do that. So most common is the yellowing of the skin and all the eye. Like medically we refer to it as jaundice, but then in our common setting we call it yellow jana. So the skin and the eye get yellow. You will also have low-grade fever.
No, get it straight. We're talking about hepatitis, and we know that hepatitis signs and symptoms: hepatitis A, hepatitis B, and hepatitis C. So, can you just differentiate that for the benefit of the audience?
No, the truth is the first strain of hepatitis. Once you get in contact with any of them, the symptoms will not. The only progress of the disease is kind of different. The symptoms because Mayu, all these viruses or each of these viruses attack the liver, the hepatocytes, which are the liver cells. And when the liver cells get infected, the sign and symptoms remain the same.
Okay.
It's not the progress of a disease that's of concern. Like if it came in contact with B or C, you know that the outcome of a disease will be far different from even somebody who came in contact with hepatitis A or that, even E.
Okay.
So the symptom is general, that is yellowing and of the skin, and that's what they are. That we call jaundice, and somebody will call it yellow jaundice in our local setting. You will also have low-grade fever. You will have joint pain. You will have abdominal pain because maybe the liver is located in the abdomen, particularly in the right upper quadrant. So you will have joint pain or abdominal discomfort. You will have pale stool. The stool will look like clay, very white.
Sure.
So you also have dark urine, all because of the passage of bilirubin in the urine, And like we said, joint pains, tiredness, weight loss. These are all symptoms of hepatitis, especially the acute stage. Because for the chronic stage, the symptoms develop over time. So you may not be able to notice it sooner, but for the acute stage, the symptoms appear sooner.
Okay, thank you so much. So you want to throw light on that?
Yeah, so as he said earlier, for hepatitis A, B, and C, they all have these constitutional symptoms.
Sure.
Meaning the constitutional symptoms are symptoms that each of them will come with. So you'll not be able to distinguish between whether there is hepatitis A or hepatitis B in the initial state of the disease until this patient has been tested. So because of these constitutional symptoms that you listed, the fever, the joint pain, the abdominal discomfort, all of them will present with that. But based on the incubation period of the disease, how long the disease has been there, then you can be able to make some clinical decisions.
So what is this incubation period?
So the incubation period of a disease is defined as the time from exposure to the time of its first symptom. So that is the incubation period. So like for hepatitis A, hepatitis B, and hepatitis C, the incubation periods are different. So if you look hepatitis A, it has an incubation period of between 15 to 50 days. So depending on which textbook you'll be using, the incubation period may vary, and the writer may say something based on their own clinical experience. So for hepatitis B, it has an incubation period between 45 to 160 days. Then for hepatitis C, it has an incubation period between 2 weeks to 6 weeks.
Sure.
So depending on which book you're using, the incubation period might be different, but the incubation period is just that time from exposure to the first
So if
sign
I
of
may
fever.
ask, how can this hepatitis virus be transmitted?
Okay, so we have what we call route of transmission. So for the hepatitis A, the route of transmission is considered fecal oral route. It's considered fecal oral route. For hepatitis B, the route of transmission is through fluid, through semen, and through blood transfusion. For hepatitis C and hepatitis B, they have similar route of transmission through blood, through semen, through fluid. So but for only hepatitis A, the route of transmission is quite different from the two.
Okay, thank you so much for that excellent explanation. So we already dealt with the signs and symptoms. So let's move by to you, Mr. Thomas. Sano. To Mr. Sano, sorry. This morning I'm not even robust. Oh my God. So let's move on to Mr. Sano. Mr. Sano, we discussing hepatitis, right? So in terms of liver transplantation, what is really the cause of hepatitis? Now we're focusing specifically on hepatitis B and hepatitis C. In terms of liver transplantation, what is the cause of hepatitis B and that of hepatitis C?
Okay, like you said, hepatitis B and C, their transmission is the same, meaning through body fluid, it will be blood. So when you say liver transplant, it has to do with, maybe you got a chronic liver disease, the liver got damaged, and then they give another person's liver. So in the process, that is why anything that has to do with blood, you have to be very mindful. In the process of the transfer of the liver, meaning giving somebody else's liver, if that person's liver is already infected with either of these viruses, hepatitis B and hepatitis C, you will also get infected with the disease. Even in the case of blood transfusion, people who do blood transfusion, that is why in the hospital setting they do proper screening of blood. Because hepatitis B and C, they are more common in blood. So once you do blood transfusion and the blood is not well screened, you are also prone of getting hepatitis B or C.
Okay. Thank you so much. So we were just discussing the incubation period, and you're giving a different type of incubation period because this virus is systematically assigned with alphabetical numbers, right?
Yeah.
So now let us look at what are some of the warning signs, especially when it comes to hepatitis A, B, C. We're going to focus strictly on hepatitis A, B, and C. So what are some of the warning signs? That when you feel this sign, you come down with these signs, I gotta see my doctor. What are some of the warning signs?
Okay, so thank you again. So as I said earlier, these are constitutional symptoms these diseases present with. The symptoms they present with are similar to symptoms that other diseases like malaria, typhoid, they will also present with them.
Yeah.
So when you have this fever, in hepatitis A, hepatitis B, the patient will present with fever, the patient will present with fatigue, the patient will present with loss of appetite, they'll have nausea, the urge of vomiting, the patient will present with pain, abdominal pain, but that abdominal pain will be localized towards the right of the abdomen because the liver is in that part. So that is where the pain will be located. The patient will have this kind of coloring urine. The patient will have this dark urine and they'll have pale stools. So once you start seeing those kind of signs, you start having pale stools, you start having dark urine, most especially pale stool, dark urine, you start having changes of the eye color, yellowing of the eye, what our people call yellow journal. Once you start having those things, you need to see your doctor as soon as possible. But for the other symptoms, some other diseases will present with them, fever, headache, fatigue, loss of appetite, other diseases will present with them. But once you're having pale stool, you're having dark urine, you're having right upper quadrant pain, you must see your doctor as soon as possible.
So how can we diagnose this whole hepatitis? How can it be diagnosed?
Okay, so the diagnosis of hepatitis A, B, and C, they are clinical. They are done clinically. Yeah. So for us to be able to diagnose hepatitis A and hepatitis B, we must do what we call the hepatitis test. You do the hepatitis test and you do a hepatitis profile test. So for hepatitis A, we have the antigen that we look for. Most times they look for it in the stool because since we say the mode of transmission is fecal oral route, they look for it in the stool. So you have the hepatitis A antigen from the stool, and you have the hepatitis A antibody. They check for hepatitis A. So for hepatitis B, how it is diagnosed, we do the same hepatitis screening, but the first screening that is done, they check for a specific kind of antigen called the hepatitis surface antigen. So if the hepatitis surface antigen is present, it means there's an infection ongoing already. When it is present, it means you need to do further investigation, which is called the hepatitis profile test. So the hepatitis profile test will do the rest of the other viral screening. So once you do the hepatitis B test, you will find the hepatitis surface antigen. Once it is present, you do the hepatitis profile, you check for the hepatitis anti-surface antigen. Once it is present, it means that person has been vaccinated, but is also exposed. So the next one we check for the hepatitis core antigen. If the hepatitis core antigen is present, it means the person is exposed and there's an ongoing infection already, active ongoing infection.
All right, thank you so much. Thank you so much. Thank you to all of our social media viewers. Thank you for following our page. We got a lot of people watching you guys. We got Dr. Stephanie, Dr. Sam Morgan. Thank you so much for following from the Atlantic College of Medicine. We got Dixon Coffer, great job. Thank you so much so we got a lot of people. Thank you so much for listening to us. If you are listening to this important topic, you can keep your calls coming in 0770-107-107, 0886-107-107. call and ask our guest panelists all of the questions you want to know about hepatitis. Call and share your experience with us on this important disease. So keep your calls coming in, Again, hepatitis is a public health concern. In the country, we are taking action against the disease. When we want to take action against the disease, it begins with awareness. So keep your call coming in so that we can keep you updated, and you can also share your concern with us. Whatsoever you don't understand about hepatitis, keep your call to me 0770-107-107, 0886-107-107. So call and ask our studio guests all of the questions you want to know about hepatitis, all of your concerns. So now we move back to Mr. Thomas. Mr. Thomas, why do we need the vaccine?
Thomas?
Good morning, Anima. Where are you calling from? Good morning, Anima. Where are you calling from? So we lost that caller. So you can keep your call coming in 0770-107-107, 0886-107-107. Good morning, Anima. Where are you calling from?
Hello?
Good morning, Anima. Where are you calling from?
Hello?
Good morning, you're live.
Hello?
You are live, Anima. Where are you calling from? Oh, we lost that caller again. What's going on? Keep your call coming in 0770-107-107, 0886-107-107. If you're outside Liberia and you want to be part of this important discussion, you can call our WhatsApp number +231 880-571-223. Good morning, your name and where are you calling from?
Yeah, good morning. I'm Joseph Bruno calling from Bandersville.
Yeah, Joseph, welcome to Health Talk.
Yeah, thank you very much. And thank you to our presenters there in the radio room. I've been following that on how they present about hepatitis, but there's something I want to find out on.
Okay.
Yeah, they say that hepatitis or the liver problem, people want, whenever they come down with it, they don't take injection. I want to know whether is that true or not.
Okay, thank you so much. Keep following the show and we'll address the concern.
Okay, thank you very much.
Okay.
All right.
So keep your call coming in 0770 107-107, 0886-107-107. So our caller is concerned. He said it is true. There's a rumors or things in the area that hepatitis people don't take injection. Is that true? So either of you can address the question.
So let me address that quickly. That's a myth. The truth is, in our setting, when people have jaundice, and they refer to as yellow jana, they don't consider it as a symptom of a disease. They will either choose to either go to a herbalist or a traditional medicine person to do treatment for them. Or if you have hepatitis and then you go to the hospital, they do your test and you are confirmed positive, they are giving injection, they can treat you, they are antiviral treatment. So to say when you get hepatitis, I don't know which of the injection you're talking about, but I don't know about any injection that is contraindicated in people who have hepatitis. So it's just a myth that people got out there that when you get hepatitis, you get the injection, with the injection, something will happen to you, or even the disease will progress, or you will deteriorate in the process. So that's how people know that jaundice or yellow jana is a symptom. So once you have it, means there's ongoing or infection going somewhere, like you need to go to the hospital to be able to do a checkup, then sitting home, and then going to herbalists or traditional medicine people to do testing or treatment for you.
Okay, thank you so much. So it is a myth. If you're listening to us, the question you asked, they do take injection, but when you get some of the warning sound like the doctor was saying, good morning, Anima, where are you calling from? Can you please leave your monitor, please? Can you please leave your monitor?
Hello.
Good morning, Anima, where are you calling from? Yeah, Augustine, welcome to Health Talk.
Okay. Oh, my concern about the topic under discussion, which is the hepatitis, if it is considered to be contagious and also dangerous, why is it that the health staff cannot bring in the vaccine to understand that there is vaccine? Why they cannot bring in the vaccine and then press on the public. That's how they are forcing us to take the COVID-19 vaccine. What they cannot bring into the program and then compare people if it is a vaccine that will take like maybe after every 6 months or after every 10 years. What they cannot bring in and then force the public to take it because it's a worldwide thing that is killing people every day. Yes, that is my concern. Why the vaccine cannot come? Why they cannot speak on it? How they are speaking on this and deliver on the COVID-19 vaccine? Yes.
Yeah. Thank you so much for your concern, but the vaccine is here. The vaccine is at Captain Hospital, the Vera Hospital, but you gotta pay to get it. 3 my days of working.
What I understood about the deliver vaccine, when we go hepatitis, they used to have to like after every 10 days, we found them all over in the community, and down to school, training, and then clinic. Yeah, encouraging people to go and take it, but then after the 10 days, when we took it, we are not seeing the healthy, team brethren, speaking to the public about their clinical vaccine.
Okay, thank you so much. We address your concern.
Yeah.
I do believe that the vaccine is in Liberia because my days working at Captain Hospital, the vaccine used to be there. At that time, it was $10 to take the vaccine. And one thing again we didn't mention, the vaccine can also be given at birth. The BCG, right?
No, the BCG.
There's something, man. How do you call it? They got a vaccine.
The
Penta.
Yeah,
they gave the Penta.
In fact, it's part of the WHO policy.
So all newborn babies gotta go through that routine. Then they also have the vaccine for adults.
Yeah, we have hepatitis A and B vaccine. And in other countries like China, they also got E.
Okay.
There are more investment
But I know more about the B.
The B is here. They got a lot of diagnostic centers, laboratory centers that offer.
So to the callers, the vaccine is in the country, and I do believe maybe that the awareness aspect, people doesn't know where the vaccine is, right?
Yeah.
So I think.
So so thanks to the caller who just called concerning the vaccine issue. The vaccine for hepatitis A and B, they are available. You can visit the nearby hospital where you stay, either the JFK, the Cali Hospital, the ERW Hospital, Jimadi, the Redemption. You can even call a diagnostic group called Matu Diagnostic. They also have the vaccine available, and it is just $10. Yeah, so for me, I think the problem we have been having, we have been making excessive awareness. Making excessive awareness towards the hepatitis. So that is why people feel that it's not around or it's not available again.
Okay. So Mr. Sano, why do we need the hepatitis vaccine? Why do we need the hepatitis, especially the A and B vaccine? Why?
So let's take it from the neonatal time when you are born, right? Under the transmission of hepatitis B, for instance, it's also called vertical transmission. Vertical transmission is where the mother who is hepatitis B positive transmits the virus to the unborn child in utero or during breastfeeding. So it is important that when she's pregnant, she get treated so that she can, prevent the child from getting the hepatitis. But if a child is born, the vaccine is given so that the body can produce its own antibody to fight against subsequent times, just in case you get exposed to the hepatitis B virus. So that's why we take the vaccine. We take the vaccine so that the body can be able to provide defense mechanism, so that in time to come when you get exposed to the virus, the body will be able to fight it, and the progress of the disease will even be less as compared to somebody who has not been vaccinated. Yeah.
Okay. So that's why it's important.
It's very important and the vaccine are all around here. You talk about Matu will get a vaccine $10. They even do the test for 500 LD.
It's also good to be aware of your status.
Yes, it's very important. It's very, very important to know.
Okay, if you're listening to us on this show, the numbers to call and be part of the discussion: 0770-107-107, 0886-107-107. Call and share your experience. Call and ask our guest panelists all of the questions you want to know about hepatitis. Good morning, your name and where are you calling from? Oh, we keep losing that caller. So keep your call coming in 0770-107-107, 0886-107-107. If you're outside Liberia and you want to be part of the discussion, you can call our WhatsApp number +231-880-571-223. +231-880-571-223. So that's our WhatsApp number. So keep your call coming in. Ask our guest panelists all of the questions you want to know about hepatitis. And remember, yesterday was World Hepatitis Day.
Sure, yeah.
Yeah, and the theme for this year is I Can't Wait.
I can wait.
Good morning, your name and where you got it from?
Hepatitis.
Good morning, this is Christopher Minty, and I call from the PJSL.
Yeah, Christopher, welcome to Health Talk.
Yeah, thank you. And let me say good morning to your two senior panelists, Manager and Baba Sano.
Good morning to you.
Morning.
Yeah, I have a question for your panelists. If one comes down with hepatitis B, are there a particular diet that he or she will be living on while the treatment is over until he or she starts to eat our regular food?
Okay, thank you so much for that question, and the guest panelists will address the question. So you got a question right. If one comes down with hepatitis, what are some of the diet that is required for the person?
This is a big response to that question. So, if you are diagnosed of hepatitis, depending on which stage, whether it is an acute, whether it's in the acute phase or even the chronic phase, you still maintain that normal diet. You still maintain your normal diet. But the only advice we give to patients who are diagnosed at that stage is lifestyle modification. Because as I said earlier on in my introductory statement, we said there are some non-infectious causes. So we mention alcohol and we mention medication drugs. So once you are diagnosed, we advise you on your lifestyle modification. If you used to consume alcohol, you need to stop, because these are things that are exposing you to hepatitis. If you used to take in some unprescribed medication, for some patients who just take pain medication because you just feel pain at any point in time and you just overdose yourself, we tell you that these are things that you need to stop. So for diet, I think you continue your normal diet, and the only thing you just have lifestyle modification related to your risk.
So you keep focusing on normal diet. We're in Liberia, because when we talk about dieting, you gotta be specific that the people understand. Normal diet, like what are some of these foods that you need to eat?
Okay, so some of our normal Liberian diet, our normal diet for a Liberian man, once you don't eat rice, it means you have not eaten. So you have your rice, you have your bread, you have oat, and those normal Liberian food that we eat to keep us up. Your normal diet, you continue your normal diet. Just lifestyle modification relates to alcohol consumption, as relates to drugs. Those are the things we really.
Remember, we are talking about the liver here, right? Because our main concern was the inflammation of the liver. So you also need some fruit that will also help to sustain that liver, because hepatitis is not only about transmission. You even though you get it from person to person, but you also get it from alcohol.
Yeah.
Through alcohol consumption. Then you also get certain medication can damage the liver.
Sure.
So when we're talking about balanced diet, you also have to look at the liver by eating enough cow liver. I know some people will say, yeah, she just for eating cow meat today. No, I'm not talking about that. You need to balance your diet, like he will already say. You need to balance your diet. Make sure you eat your proper diet, nutritional food, so that it will sustain you in your body. And if you somebody like consume too much alcohol, especially like so money, you don't put anything in the system. Then your first shot, the alcohol, you need to curtail that also. It is not good for your health, because you damaging your liver, and your liver play a key role in the functions of your body. If you damage your liver, you damage yourself, right? So, what do we need to recommend for people or for those diagnosed with hepatitis A? What is your advice, Mr. Sano?
Okay, so I don't know much about Liberia, but in other advanced countries, they have group like got hepatitis B society, in other countries. So people who already have hepatitis that have been diagnosed, like my colleague said, we just have to modify. They have to go through the lifestyle modification process, because Mind you, if you already got hepatitis and you start to take in harmful substances, we know the role of the liver in terms of detoxification. So if you start to take in herbs, taking in some of these drugs that we talk about, like the paracetamol, the diclofenac, in high doses of frequency, you are also
Good morning, your name and where are you calling from?
Yeah, my name is Frank Johnson. I'm called Marana Street.
Prince Johnson, welcome to Health Talk.
Yeah, I'm very happy on this delegate talk because I'm a patient for this. Yeah. The injection you talk about, because up to the time I ain't able to go take the vaccine because I can take paracetamol, I can take harm medicine with calcium, I don't drink any day drink. So if you take the vaccine, because I like to say I'm on B52, liver 52.
Yeah.
Yeah, so I went back, the routine, they tell me that I'm taking B2 and B complex. So if the vaccine is available, if you take the vaccine, there will be no effect, the injection.
Okay.
So I want to ask, for the injection, when you take it, there will be no effect, because I can't take injection.
Okay, thank you so much and keep listening to the show. Our studio guest will address that.
Alright.
Alright, thank you so much. Yeah, he said he is a hepatitis patient and he on a B52 pills. So now he's concerned if he can take injection. His doctor already told him to be taking B complex. So his major concern here is can he take the injection?
So now, before you recommend our patient to go and take the hepatitis vaccine, the first thing we would like to recommend for him, if he's still listening, is for him to go back so we could repeat his liver function test and do his hepatitis profile test.
Sure.
Once we do that and we notice that the surface antigen is negative, then we can recommend the next step for him. So if he's listening, you gotta come back to the hospital, we do your liver function test, we do your hepatitis profile test, then we can recommend the next step for you.
Okay, thank you so much. Yes, I think that's the best solution. Go back to Dr. Osi. I didn't know that Dr. Osi worked with him before at the hospital. So go back to the doctor. They will do a proper test for you and see your liver function, and then they will tell you whether you are eligible to take the vaccine or not. So thank you so much. So now move to Mr. Sana. Mr. Sana, we're talking hepatitis now. So everything is about hepatitis today. How can this hepatitis be treated?
So for hepatitis A, which is less severe, most of the time it resolves, by itself. For hepatitis A, like I said, the most common one is hepatitis B and now the C. So when you go to the hospital, when they have done the test and it's confirmed that you got a virus, they got antiviral medication they can put you on.
Okay, thank you so much.
They got antiviral
Because
medication.
we don't want to call medication, that's the reference.
Yes, antiviral medication,
The
yeah.
class, and then we discuss it because we don't want someone to go.
No, yeah, to go and buy it. So just create awareness.
Yeah.
We just create
So,
awareness.
now we move back to you, Mr. Gerald. Can you share with us what are the best practice to avoid, or what are the best practice to avoid hepatitis, or what advice do you have for the public?
The advice for the public, for our listeners on social media and in radio, for hepatitis A and hepatitis D and hepatitis E, we say they are transmitted through fecal-oral route. So the best way to prevent them is proper hygiene and good sanitation. So proper hygiene and good sanitation is the first hallmark. So prevention is better than cure. So if we advise and we keep teaching our people how to prevent themselves and keep the environment clean, the issue about hepatitis will reduce.
I think this is the last caller now. Good morning, your name and where are you calling from?
Good morning, David. Little Yerin calling from Riyadh.
Yeah, Yerin, welcome to Health Talk.
Yeah, thank you. I want to ask, apart from the causes of hepatitis, they got this by drinking liquor and maybe doing blood transfusion, all those things. Can hepatitis be a family sickness where maybe your father has it from a child It's going through that bloodline, just like that. I really want to know.
Okay, thank you so much. Keep listening. We'll discuss that.
Okay.
Okay, can you just brush over that before you go to your question?
Alright, so hepatitis, like the way you put it, another type of hepatitis we'll talk about is the autoimmune. The autoimmune is where in the body will produce its own antibody and start to fight it. But that it's more like genetic and now environmental. Well, the easier way to transmit hepatitis to an unborn child is with the mother, not the father. So if your mother was pregnant and she
Yeah,
had
to deliver.
in
especially-
utero,
yeah.
you could be exposed to the hepatitis. As particular hepatitis B, you could be exposed
Yeah.
to hepatitis in utero. And even doing breastfeeding, we said that proving
Breastfeeding.
that you got some of the
Even through sweat, body fluid.
yes,
Yeah.
you can be
The B
so
is
it's
very
not
good.
like the hereditary disease where it passes through bloodline. No,
Okay.
that's not what it is.
Okay, so time is fasting. We are almost like in our concluding Iraq because the time in studio now is 11:47, so we'll soon be leaving here. So let me just ask this general question, just 2 minutes each. What are the ways and means that our audience can take care of their liver? So we say inflammation of the liver is hepatitis. So what ways and means can our audience, those that are listening to you, those that are watching you, what can they do to at least take care of their liver?
So best practice, let me start. So the best practice to take good care of your liver or to have a very healthy liver. One, we say, we all know that the liver can regenerate. The liver regenerates and the liver also degenerates. So we advise our people listening to us, avoid those things that will put you towards going down the road. Avoid taking unprescribed medication. Avoid overdosing yourself. Follow doctor's order. Make sure you do your hepatitis test. Have proper personal hygiene. Good sanitation.
About good sanitation, I think about the street of Liberia where the trucks are passing without you smoke.
Okay.
Oh my God. So can you please give us some means and ways that the audience can take care of their liver, Mr. Sano?
So in addition to that, we get something called alcoholic hepatitis. So these are people who drink excessive, alcohol, who are involved in alcohol drinking. We advise them to